I'm Dr. Caton Simoni. I am an obstetrician and gynecologist. I've been working for about 13 to 14 years as in the specialty, and I work in New Braunfels Comal Women's Medical Associates. So it varies. Now the guidelines say that you don't actually need a pap smear, which is a screening for cervical cancer, until age 21. So that's a little different from 30 years ago, where people came in and they had a routine exam and had a pap smear and very early. So sometimes people don't need pelvic exams right away. And so sometimes I see people for actual problems as far as like periods or pelvic pain or birth control. And so I'll see them for specific problems. And then if they need an exam, we kind of work together and decide if we need to do an exam. So a first OBGYN visit, depending on your age, is sometimes just sitting down and talking about issues. If it's something for a specific problem, sometimes it does involve a pelvic exam, which is feeling your uterus, looking down around the vagina and looking at the, as far as like, is there any abnormalities? But the first visit usually is a history, as far as like if you're sexually active, any history of sexually transmitted infections, kind of the whole, your history, because it's important for us to know. Typically we'll have you leave a urine just in case we need to do birth control. We want to make sure we know what your pregnancy status is. And then, like I said, going over your concerns and questions. And it's sometimes just a sit down talk to see what's going on. Sometimes it is an exam. So it just depends on why you're there. So my advice for being nervous for a gynecology exam is that it's okay to be nervous. It is not a natural human nature to be comfortable when someone's looking at their private parts or talking about very private things. But I think understanding that when you're talking to an OBGYN doctor, that's a safe zone. We have talked about these things before. And if you can't tell us, who else are you going to tell if we have a problem? I think the big thing is during exams, we always, we say try to relax, but that again is not something that comes natural. So just, listening to your doctor, they'll tell you how to kind of sit and different things that helps. But just understand that it should be a safe space, and it's something that we're there to help you, and we want you to be as comfortable as possible. What should parents be prepared for? So a lot of people, like I said, a lot of moms especially, they remember pap smears every year. So just understanding that may not be the case definitely for your teen, but also daughters, is we're not doing pap smears. A pap smear is actually using a certain brush and paddle to look for cervical cancer cells. Sometimes there's a vaginal exam that's looking for, like, say, yeast or some discharge. So those are two separate things. Sometimes we'll do a vaginal exam if your teen has some complaint of something vaginally, but we don't necessarily do a pap smear. We know a lot more about cervical cancer, and so now what we've found is that we do not just an exam to look at the cells under the microscope, we also check for HPV. And HPV is a big on switch for cervical cancer. So if you do not have HPV, the risk of you having cervical cancer over 3, even 5 years sometimes is extremely low. So that's why sometimes you'll find that we stretch those exams out. And it's not because we're missing stuff, it's because we know a lot more about it and how it works. Also, there may be a time where we enable the team to be able to tell us something that they may not want to tell in front of you. And our job as a doctor is to give a safe space. And so sometimes we may ask you or the team to, do you want a space to be able to talk to us without your parent or guardian? And depending on your comfort zone and age of the teen, sometimes they say yes, sometimes no. So it's not something to be upset about. It's just health-wise and privacy-wise, that's important. So I'm Dr. Caton Simoni at Comal Women's Medical Associates. I know seeing OBGYN is not someone's favorite thing to do, but it's important. And if you keep up with your health care and take care of your body, you're overall, making sure that you have a long, healthy life. So it's important to come in, and we'll try to make it as comfortable as possible and make sure that you're taking care of yourself like you deserve.